It's 5:15, and I will officially call the April 28th, 2020 Board of Trustee meeting to order. Before we begin deliberating on tonight's business, can I ask Dr. Morrison if she would lead us in prayer?
Most gracious Heavenly Father, thank you very much for today and the life we share and the people we share it with. Thank you for this county. Thank you for this hospital. Please give us wisdom tonight so we can do the business of medicine as you would have it done and take care of both the employees of the Lincoln Medical Center and the people of this county that we should serve. We thank you for your hand of protection around our hospital, around our staff, our physicians, and our county. We have been truly blessed in this COVID moment. I hope we do as well in the future. I pray for your continued protection along these lines. Let us make good judgments here, and let all things be done according to your will. In Christ's name we pray. Amen.
Amen. Thank you. With all 7 board members present, we can conduct business. The first agenda item is the consent agenda. Before we act on it, are there any items in the consent agenda that the board would like to be taken out for separate discussion? If not, I entertain a motion to approve the consent agenda as submitted.
Motion approved.
Motion made and properly second. Any discussion? All those in favor say aye.
Aye.
Opposed say nay. Next agenda item is the health system bylaws. And the old bylaws, the marked up ones are attached along with the new one. Dr. Edwards and Dr. Morrison, everything looked okay to you all?
Yes.
Okay, if so, I entertain a motion to approve the amended bylaws as submitted.
So moved.
Motion made,
Second.
properly second. Any discussion? All those in favor say aye.
Aye.
Opposed say nay. Next is the quality report. The quality report is being submitted. If you got any questions, please review the report and then contact Courtney Sanders for any clarifications that you may need. With that said, I will entertain a motion to accept the quality report as submitted. Motion made.
Second.
Properly second. Any discussion? All those in favor say aye.
Aye.
Opposed say nay. Chief of Staff report.
I'm sure everybody knows by now we had the passing of Dr. Alston, and sorely be missed. Dr. Bain has agreed to take over Credentials Committee, and Dr. Crump will be joining the committee.
Okay.
Other than that, it's as submitted on the Senate agenda.
Okay.
Who did you say was taking over?
Dr. Sane,
Sank.
everything's a little muffled in masks.
Okay. Entertain a motion to accept Dr. Klein's report as submitted. Motion made. Second. Any discussion? All those in favor say aye.
Aye.
Opposed say nay. Senior administrative report.
All right, that is me that starts out. I wanted to just give you an update on COVID-19 and all the work that has been done surrounding the virus. It takes up much of our time. I would say Courtney Sanders, who is our quality director of infection prevention, it has taken up about 100% of her time and probably 65 or 75% of my time over the past 2 months. We actually started working on COVID-19 on March the 3rd, so we're coming upon 60 days that we've been working very hard. We get frequent guidance and process updates, changes from the Tennessee Department of Health, the CDC, CMS, and from the Joint Commission. And so when we get those updates and changes, we have to update our policies and make sure that our staff get educated. In the beginning, when we first started with COVID-19, it was pretty frustrating because we would get guidance one day on a certain type of masking, and then within 2 days, we'd have to do something else. And so in the beginning, it seemed like we were educating on a daily basis. That guidance is now pretty solid, and now we're just doing a lot of tracking, monitoring, measuring, and those types of things, testing of patients and those types of things.
Okay.
That doesn't, one of the things I wanted to let you know is that regulatory entities such as CMS and the Joint Commission have suspended all reporting for right now. And that doesn't mean we aren't monitoring, it just means there's gonna be a delay in the reporting process. And because of the delay in the reporting process, that will change how the star ratings occur as well. So you'll see the same star rating this month, because it usually comes out quarterly, so April would be the month of change. And it will stay the same for right now, because we just aren't reporting, the government is not doing anything with the information we're reporting. As stated before, COVID-19 has had numerous challenges, and I've explained all that. I did want to let you know that we have all of the PPE that we need. We have had some shortages, that we're working with the Southeast Regional Healthcare Coalition to make sure that we're getting supplies. The N95 masks, do run short, but the coalition is always willing to bring us a couple of boxes when we get low. And if, anybody is interested, we are reprocessing those. And so those N95s, that really, good mask that filters out everything, we can actually put that in our sterilizer. It's a dry heat in there, and it will sterilize the N95, and then we can reuse it. And we can actually do a reprocessing of those masks twice. So that conserves our supplies. And so that may be a question that you're asking, how is the hospital conserving supplies? We are doing that. Other things that we've had some shortages on has been ventilator circuits and Sandy wipes. But, you know, back in the old days, we always used to spray and wipe with a washcloth, and we'll just go back to cleaning surfaces like we did 20 years ago. So is there any questions that you have on COVID-19 and any of the work that's being done around testing? Okay, you do probably get the updates from the Tennessee Department of Health on how many tests we performed in the county and how many positives we've had in the county. I believe today it's 12 or 13, 12.
12.
And we've had actually 3, probable 4 here in the building. We've tested 65 around, is that what it was, Russ? So we've tested numerous patients. We've had some sick patients, and do remember that sometimes those tests are not correct. There is some false negatives there in all of that, and we've had some real suspect patients. And so, very busy taking care of all of the sick patients. The thing that I think is important to talk about in just a minute, that our volumes have decreased, but the patients that we have had have been very sick in our ICU, and so it's been astonishing how sick the patients have been when they come in. Some of the other things that are going on, we continue to work on our medication reconciliation process, and that has been just a very good blessing. The pharmacy takeover has been very good. We've had less problems, less errors. I'm very proud of that process. It's going well. We will be having our skills fair coming up very shortly before June the 1st. Something I wanted to let you know that we will need a vote on is our pharmacy contract expires on April the 30th, and you know that Russ and I have been working on our due diligence of getting the best possible price and trying to reduce our expense with pharmacy management costs. And I'm happy to report that CPS will be awarded the contract pending your approval and your vote for a total savings of around $40,000.
Who's the contract with now?
CPS, and then we continue with CPS.
Okay.
And then last but not least, Hospital Week is upon us, May 11th through 15th, and we're going to really do some special things for the staff. They're tired. Our staff are really tired because this has been, even though the volumes are down, we have, it's stressful, very, very stressful. I think if you talk to any healthcare provider, we're on edge, and part of it is just having to function with something over your face all day, but part of it is the unknown. And in the beginning, the nurses, we just didn't know, are we gonna catch it from so-and-so? I think we're getting tired of the masks now. But anyway, it's been stressful, so we're gonna try to treat them, and the rest of the staff, the week of hospital week, get a picnic and then do some special things for them.
Would you also relate to the staff, the board's appreciation for their dedication and commitment to do what they're doing here? And I know it's very stressful, but, you know, they're answering the call, and they're providing a service that you can't even articulate. So, anything else?
I'm done.
Okay, entertain a motion to accept the CNO's report, including the pharmacy contract with CPS that will result in a $40,000 savings per year.
So moved. Second.
Motion made and properly second. Any discussion? All those in favor, say aye.
Aye.
Opposed, say nay. Next is finance.
Thank you, Mr. Chairman. On the dashboard, I'm just going to hit some key highlights. As Carrie kind of mentioned, the significant driver, obviously, in this month with COVID-19 was obviously a significant drop in activity, and it's like a light switch. March 15th, suddenly, the switch was turned, and we saw a dramatic downturn in your outpatient-related activity. And again, we'll go through all the details here, but basically it goes through ER and outpatient surgeries, your diagnostics that are related to the surgeries, all of those peripheral ancillaries were impacted mid-month. So as you can see, just glancing at the numbers, the volumes were down, with the exception of inpatient. Inpatient kind of hung in there, and we actually will see an increase in inpatient in April. As Carrie was saying, too, the folks we are getting in here are sick. They have extensive comorbidities, et cetera, and respiratory distress, et cetera. So we are seeing that occurring at the same time that we're seeing the drop-off in the outpatient arena. So having said all that, kind of want to mention that. The other thing that kind of hit us, too, is, again, the mix kind of shifted. Your inpatients being primarily your elderly are here. And again, those are the ones most susceptible to the virus, and so obviously, again, taking extensive precautions with them while they're hospitalized. You jump down to the bottom. The other takeaway I really just wanted to mention was obviously, again, with the volumes dropping off approximately 40% mid-month, made it difficult to react quickly, as far as adjusting certain things, but we did a pretty good job at that, but still, when you take that kind of a hit on your net revenues, it shows on your bottom line. Now, if you just jump to the very bottom, like I said, the whole system as a whole had a negative $382,000. That's with half a month of COVID ID. I would expect April, with the full month of COVID-19, basically probably being higher than that. So that's why we've been focusing on trying to obtain some of these special funds that are available to us, knowing that, potentially you could be looking at, $1 million or more in cash flow that we need to cover in a 2 to 3 month period. Are there any questions on that? Otherwise, it was
Just one observation.
Yes, sir.
The ER conversion to admission was
high.
well, it's not as high as they said, but
No,
it's higher than it
it's
has.
higher than normal, and
Right.
exactly my point being, ER visits were dropping off dramatically,
Right.
but the folks that came in the ER, they were sick. And as you recall, obviously that makes sense because everyone was being told to stay away from the hospitals if you got minor stuff, you don't want to catch the virus. So the folks that came here were sick into the ER. That's a good point. All right?
Okay.
So having said that, let me move on a little bit to my CFO report and quick hitters. We're just moving forward with the Athena EMR over in the physician arena. We've had the kickoff meetings. We've had 3 conference calls, and things are underway there. Again, won't belabor that. The next 2 items I will just mention again, we were talking about expanding our specialty complement here. Urology, Dr. Tefedino begins May 8th. I believe that's a Thursday. And then OB-GYN on Monday, May 4th, Dr. Nobles begins his full-time practice of obstetrics here. So we're excited about that.
And gynecology.
And God, yes, thank you, OB-GYN, yes. That's important, thank you. 340B, there's really not much there. TennCare payments, Russ has been actively working on that and got some legal folks involved and Pat Marsh, and we certainly want to give public recognition to Pat Marsh's involvement in this because he knew the right people to bring to the table. And working with Russ, we now have the attention of all three MCOs with TennCare, and basically they're looking at our data that we believe indicates that we've been underpaid based on the corridor payments that we're supposed to be obtaining. So that looks like it's gained a lot of traction, and Russ has heard back from, I think, each MCO looking to try and quantify what the amount might be and how we may benefit from that. So that could be a big boost for us. And last but not least, I kind of want to just go over for you because it's been quite unusual, I would say, around here as far as procurement of funds to try and help us through this difficult time. But I want to mention, and I'll just try and recap some of these, and you all have been hearing about these in various news releases about the billions of dollars are being distributed, et cetera, and whatever. So the first one I wanted to talk about was the CARES Act. That's the federal stimulus payments that were paid out. In the first round of that, we were able to get $416,000 for the hospital, $182,000 for the nursing home, and then $91,000 for home health. The second round of that, we were able to get $270,000 for the hospital and $53,000 for the hospital. So again, significant dollars. Those are all going to be needed to fund us through this difficult 3-month period. We also were very fortunate. The state worked with us and granted us a grant, $341,000. That was an extensive application. Russ and I worked on that, and we were very grateful to receive that assistance as well. Working with THA, we have asked that any payments due from the state and or TennCare be accelerated. And in fact, they did come through with that. We are due a payment normally in June of about $634,000. They accelerated it and made payment to us now, so we can use it in the most dire time from a treasury management standpoint. They also surprised us with supplemental payments that they had been working on, but they pushed to bring it to fruition in a very timely manner, and it granted us an additional $384,000. So that puts a total from the state for these special funds, essential access, DISH, whatever you want to call it, $2 million for the year. Again, as I've mentioned before in my presentations to the county, this place is very dependent upon these special payments from the state. So, and Dr. Morrison just left, but again, $900,000 of that $2 million is due to the fact that we're an OB provider, and of course render significant charity care, significant TennCare. So those are the biggest cash inflows, if you will, that we've obtained. Now, I will say this, now we broached some loans or advances. Medicare allowed us to obtain a Medicare accelerated payment advance, almost $2.5 million. That represents 6 months of Medicare funding. Now, again, that's not granted free to us. It's a loan. So they will start clawing that money back in the fall over an 8-month period. And then everyone's still kicking that around right now. It's if you don't pay it all back within a year's time, the interest rate was, pretty high. But right now, there's folks pushing to make it a very reasonable interest rate against as providers. I've never seen an era where everybody's really trying to assist hospitals the way they are right now through this crisis. So that's something yet to be seen. And then the other thing is, just to let you all know, again, it just kind of happened, but we did pursue the Small Business Administration loans and just received word today that those were approved. So we'll be working on getting that funding as well. That is a one-year loan at a very attractive 1%, but greater than that is the fact that it's actually forgivable if you hit certain terms. So we'll be obviously working toward that. And basically, it deals with keeping your workforce employed during these difficult months. There's a lot of businesses, obviously, that weren't able to do that. They were put into the unemployment world. So we're
Is that the term for this one? To make sure you
Yes.
maintain your workforce?
Yes.
Okay.
Yes. And we've got that action plan in place, or we'll have it in place, so that we're going to meet that.
Okay.
So really, that's kind of a wrap-up.
On the others, the CARES Act and all those, what are the use restrictions? I know some has to be for operations. Are there any particular things that we need to be aware of that?
Not that I'm aware of.
Okay,
Basically, just to get through this crisis.
okay.
And basically compensate for the fact they realize your net revenue intake is down significantly.
Yeah. Okay.
Are there any questions? Yes.
I don't want to steal your thunder, but I do want to make sure that we acknowledge that our HRSA, audit report came back, and we want to make sure the board knows that we had no findings.
Good, thank you.
Yeah.
Good.
For that forgivable 1% loan, did we go through a local bank or?
We did.
Okay.
We did.
Do we want to mention who that was?
First Bank, very appreciative of their efforts to assist us on that.
Appreciate your efforts and Russ's efforts in making sure that we're included in this type of situation, because this is really one of the only ways we can survive.
That's right.
But we're not by ourselves. Every hospital in the nation is facing the same situation. Okay. Any other questions for Bob?
I would like just to make a comment that I think our leadership team is keeping our rural hospital funded and going. They're doing a great job.
Yeah.
I mean, it's not easy getting these grants. It's not easy filling out all the forms, and
Yep.
they're kind of making it look easy,
Yeah.
but it's not easy.
Yeah. Well, a big shout out to Russ and to Bob for the extra efforts that they're doing and showing the results. And that's what's really tremendous. So thank you all, along with the staff, your regular staff as well. Entertain a motion to approve, accept Bob's report as submitted. Motion made,
Second.
properly second. Any discussion? All those in favor say aye.
Aye.
Opposed, say nay. Next is the CEO, Business Development.
Thank you. So just to echo some of what Terry's already said, just acknowledging the efforts of our collective workforce, the medical community employees truly stepped up and doing great work there, and we so appreciate their efforts. And it reminds us of how fortunate, how blessed we are to have the community that we have and that the employees of the health system. So grateful for that. And looking at on Bob's report with the $380,000 loss in March. Of course, no one ever could have imagined something as profound as COVID-19, but as a system, we felt we were on the right track. We had a strong February. Was a strong month for us. That was preceded by January, which we thought we really had arrived. So February was better. March started off well, but then we certainly hit a wall called COVID. But with this funding that Bob's mentioned in his report, it really allows us to bridge this period of the pandemic and emerge on the other side in a strong position again, so that we're not in a hole. We haven't dug a hole over these last days, and we've certainly seen volumes trail off, no elective, no non-urgent surgeries. Endoscopies have come to a screeching halt. Our outpatient volume's down, averaging 3,000 a month to 1,800. ER visits averaging 39 a day to 21 a day, and all that has a huge ripple effect. And we're glad we learned yesterday that the governor is not going to extend the order as far as no elective or non-urgent surgeries after that April 30 executive order expires. So our plan is next Monday, May the 4th, we will begin operating again elective and those non-urgent cases. We've met today as a group. Dr. Crump is chief of surgery, president, and we've got everything lined up there. There was leg work that needed to be done, some that still needs to be done, but we'll be in a good place and ready to go from January. And we're also seeing this backlog of cases. Now, we're doing it in such a way that we certainly can safeguard staff, visitors, and our patients. So there'll be some order to how all that work proceeds. But we're certainly grateful to be able to offer those surgeries again. And then that kind of ties right into, we look at some of the new doctors who are going to be joining us soon. A lot of them have that surgical background, so that's going to be important to our case count, and just offering services locally. In some cases that we haven't offered in years, others in a year. So Dr. Nobles, the OBGYN, is actually in the office this Friday. His first patients are already scheduled for Monday. We'll, very much as we did with the orthopedist, Dr. Beasley and Ryan Parton, the nurse practitioner, we had the mailer went out to every mailbox in the area, over 18,000 mailboxes. We're doing the same thing with Dr. Nobles, so that's being teed up as we speak, and also with some additional advertising. Dr. Tapadino, we're looking at Thursday, I think May 7th, May the 8th from there, so we're looking forward to having urology return to the community. You know, that time when we're doing urology cases here, I think we had about 104 cases per year. There's no reason why we can't see that and then some. So we have purchased the laser that was necessary. So we got a good deal on that, and we're ready to go in that regard. Dr. Cox, the cardiologist, we really put all that on hold, quite frankly, with COVID-19, and he reached out to me. This Monday, it was last week, asking what's the status, and we're saying late May, early June, we'll have things ready to go. By then, we should begin to see some order restored to the organization. So looking forward to that. And as I've already mentioned about these elective cases starting again, and we'll also with that we'll see the trickle down to the Patrick Rehab for those outpatient therapy visits. We look at the nursing home. We've had a huge impact on our skilled census, and a lot of those admissions per month are surgical patients or orthopedic patients. So Dr. Beasley, in March, I think he had 10 admissions to the unit for his patients, even in that short time. So we're looking forward to getting back to a routine there as well. So a lot going on, but we're managing through. We're on the right track. So, thanks, sir.
Any questions for Russ? If not, entertain a motion to accept Russ' report as submitted. Motion made.
Second.
Properly second. Any discussion? All those in favor say aye.
Aye.
Opposed, say nay. Financial operation, we pretty much covered that's what you just said a few minutes ago.
Yes.
Human Resources, entertain a motion to accept the Human Resource report as submitted. Motion made.
Second.
Properly second. Any discussion? All those in favor say aye.
Aye.
Opposed, say nay. Donaldson Care Center report, entertain a motion to accept that report as submitted.
So moved.
Motion made.
Second.
Properly second. Any discussion? All those in favor say aye. Opposed, say nay. Patrick Rehab and Wellness report, entertain a motion to accept it as submitted.
Motion.
Motion properly made. Second. Any discussion? All those in favor say aye. Opposed, say nay. EMS report, entertain a motion to accept it as submitted. Motion properly made. Second. Properly second. Any discussion? All those in favor say aye.
Aye.
Any new business?
I have a comment
Okay.
about EMS, and we've discussed this before, but I don't think it's ever went anywhere. In other counties, I've talked to some others that are on EMS. These are lift assists are typically handled by volunteer fire departments. We're sending out ambulances 20 miles to pick somebody off the floor and put them back in the recliner. Is there any way we can make an effort to coordinate with our fire department? I know at one time there was some pushback, but I don't know if we can reach out again and see. I don't know if that'll save us some money. I know it'll save us wear and tear on vehicles.
Aren't we billing those?
You know, but we don't often collect on them.
Okay.
There's a big difference.
Is that because they're not covered by Medicare?
Right there, they're private, all self-pay. We'll do that to, I'll follow up with, advise on that.
Yeah.
I'm not sure of the coordinate, we'll, if there's a way to do it, we'll make it happen.
When you say coordinate with the fire department, are you talking about the fire department going out and the EMS not? Is that what you're saying?
Yeah,
Yeah.
instead of calling an ambulance from Federal, you know, your neighbor's on the fire department, he can just come over and help you back in your recliner. You're not gonna need any to go to the hospital.
Do they always identify that in some manner that's reliable, that it is just a lift assist?
That's the way it comes out over the radio.
Okay, it does come out, okay.
And
I
if the fire department gets it, they can always call EMS.
Yeah, if it's safe to get there, that's a little bit more serious.
Yeah.
I didn't realize it was identified that clearly in advance, so that makes even more sense.
We got that on there? Do we have? Okay. Any other new business? Thank you.
It's a catch-22 as far as the county is concerned, because the fire department, if that's, we utilize them more, then they're gonna come in and say,
Well, of course, if they don't respond to the lift assist, you know, like the first responder or the fire department, if they don't respond, then EMS would go. But if somebody's right 2 miles down the road, they say, oh, well, I can go help them, you know, then they'll respond. A lot of times they may not respond.
That's gonna be pretty tough logistically, isn't it?
Just something to look at, I'm not saying we
Yeah.
can't do anything, that's the way it works in other counties, but, I mean, there hasn't seemed to be much effort to make it work here. And it's not from I think we've reached out a couple of times, but I don't think it's been received.
Any other matters under new business? Any other business anybody need to bring up or talk about? If not, I will entertain a motion to adjourn. Motion made, properly second. Any discussion? All those in favor say aye. Opposed, say nay. That's it. Thanks.